the whole thing about like the human body and how it works for me always intrigued me with the orthopedic side of it. And so I kind of understood that probably medicine was something I should do, and probably the orthopedic side of it, because I was into kind of construction. I was always three-dimensional when I did the art. So I looked at orthopedics, and the surgical part of it is doing the same thing as art. I did the things you had to do in terms of like trying to get into medical school, and then I did the other things that I thought were stuff I already knew how to do in terms of taking care of people. So I started working at the ER, volunteering places, and just kind of getting a feel for that side of it. Since I didn't really know, I didn't have anybody in my family that was a doctor. And I just got very comfortable with that, got comfortable helping people. I realized people would look to me when they did need something, whether it was lifeguarding and swim lessons or tutoring. I was always the person that said, "Hey Jeff, what do you think? Can you help me?" And I think my affinity for the three-dimensional stuff of surgery, and then the position I always felt like I was in, like I was going to lead people in a direction that would help them. It turned out to be, you know, surgery and orthopedic surgery for me. There's probably been that interaction my whole life. It's that if that involvement is more personal, not just, hey, I'm trying to get something out of it, but more personal, that I really do want you to do better. And I think people just see that, and they say, oh, well, I want to be with a doctor that cares, and not just, I'm another number. I'm 60 people today in his office, and he's 2 hours late, and he said it was my left shoulder, it was my right shoulder, and he didn't look at the exam or the x-rays. And so we just know our patients very well. We do a lot of work ahead of time, and that gets them to understand who we are in terms of how we want to take care of them.